Welcome to today's segment. I'm Manal Ali with Benefits and Pensions Monitor, and I am pleased to be moderating such an important discussion today. Diabetes has become one of the most significant health challenges facing workplaces today. As its impact on employee health and benefit plans grow, so does the need for thoughtful, coordinated action from employers, insurers, and advisors. In today's segment, we speak with three professionals who bring different perspectives to the issue. We have Kim Siddall, National Vice President of Client Strategy at EPCOR, Alexis Wise, Vice President of Health Products and Partnerships at Sun Life, and Lana Burnstad, Senior Manager of Benefits, Abilities, and Wellness at EPCOR. Today, they'll examine how early intervention, practical tools, and evidence-based strategies can support employees living with diabetes while helping to maintain the long-term sustainability of benefits plans. Ladies, welcome. Why is diabetes becoming the number one driver of drug spend in insurance plans? And what are the implications of diabetes for employers and insurance providers? I think we can start with Kim.
It is a rapidly increasing therapeutic classification. And we are seeing sort of rapid growth in diabetes medication, as well as supports to help those living with diabetes, like, blood glucose monitoring supports, paramedical practitioners, things of that nature. So, all in all, it is a category to pay attention to.
Alexis, could you add to that?
Absolutely. This is a topic that we've been looking at very carefully at Sun Life, and actually just recently published a report all around chronic disease in the workplace. So we have the benefit of looking at the data, the claims data from over 3 million members. And what we know is exactly what Kim said. We're seeing an increasing prevalence of diabetes-related drug claims. And we've seen growth in drug claims between 2019 and 2023 of about 30%. And this aligns with what we know about the prevalence of diabetes. So about 4 million Canadians have diabetes today, and that number is expected to rise to about 5 million by 2033. So we're seeing that reflected in our data, and diabetes is now the second highest drug spend category and one of the fastest growing. So it's definitely a topic of interest to us and to our sponsors.
Perfect. And Lana, can you please add to that?
So I think, when I look at our employee population and I look at our drug spend, and I also look at disability in general and why our employees are away from work. And we took short-term disability in-house, so we're more attuned to the needs of our employees. So I see, whereas before I used to look at our benefit plan separate from our disability management, but they are so integrated, and we have so many people that are off, unable to be at work, short-term disability claims where they're not necessarily off because of diabetes, but it's running in the background. And it is harder to manage some of these cases. So I have it coming from a couple of different directions, as well as wellness overall. So how do we encourage our employees to be more well, more fit, have better enjoyment in life? And what's our role as an employer to foster a healthy workplace and provide awareness and be more in the preventative space before these chronic illnesses, really impact employers and employees?
Yeah, you've touched a little bit on the impact. Could you further unpack how diabetes progression impacts workforce productivity, absenteeism, and healthcare costs potentially?
Yeah, that's a big meaty question, and I think we're just on the cusp of that. I think we're moving from a two-dimensional kind of wellness platform to a three-dimensional wellness platform where we're really touching, moving, integrating wellness across not just the HR shop, but I'm working with our health and safety department and talking about diabetes, even in the context of, we have safety sensitive employees. Are they awake? Are they alert? Are they able to perform their functions in their duties? So it's a productivity issue, it's a safety issue, it's an attendance issue, and it's a cost issue. So I think it is really a fulsome, more integrated, it's a blanket over everything that we do, looking at chronic illness and wellness.
Now, Alexis, I'm sure you can add to that too. How does diabetes progression impact workforce productivity?
Absolutely echo everything Lana said. And I think we hear that from other clients as well. So we know that employees with diabetes are more likely to be absent from work, roughly 2 to 10 days more per year than those without diabetes. So employers are seeing that. We also know that about 20% of our long-term disability claims, those individuals have diabetes as at least a comorbidity. So it's part of the disease landscape that they're managing, even if it's not the primary reason that they're out for a disability claim, and making those claims more challenging, obviously, to manage and making it more challenging to support those individuals overall. And then absolutely, diabetes is a contributing factor to other chronic conditions as well. So it increases the likelihood that someone might have a stroke or a heart attack or even kidney failure requiring dialysis. And so we have to consider those factors when we're thinking about diabetes, that there are many other reasons why an individual want to manage their diabetes, and an employer wants to really think about productivity, absenteeism, cost, and overall well-being for their employees.
Perfect. According to Diabetes Canada, people with diabetes are 25 times more likely to experience vision loss, 12 times more likely to be hospitalized for kidney failure, and 3 times more likely to suffer from a heart attack, stroke, or heart failure. And so what strategies kind of can employees implement to identify and support employees who are newly diagnosed with diabetes or at the early stage of the disease before it progresses into one of these more serious states? Alexis, let's just start with you.
Yeah, I mean, we know that employers have a really meaningful role to play in the health of their employees. And there's all kinds of strategies that we're seeing employers take, and they can really range. So some employers are really thinking about how to even help individuals identify that they might be pre-diabetic. So very early prevention in terms of identifying at-risk employees. Others are taking steps to support individuals who are in sort of the early days of managing that disease. So how can they be better at disease management, and offering support programs to those individuals where they have access to clinical support, to coaching around what it looks like to manage the disease well is really important. And organizations are addressing this at the individual level, but then also across the organization by having a look at the health of the organization. So they're doing organizational health assessments, employee health risk assessments, and really building targeted prevention programs focused on lifestyle improvements and disease management. So there's a range of strategies that we're seeing in the market today.
Kim, can you please speak to this as well?
There's a couple of key kind of fundamental things that employers can do to support employees living with diabetes and their families as well. Some, I would say, just are basically to having a look at your plan design to ensure that there aren't any obstacles to care. So people aren't making decisions to not be compliant to things, to not access, sort of leading edge monitoring tools, resources available to them, diabetes educators and community, those sorts of things. So just sort of take a look to see sort of where medications live, where adjunctive supports live, what the co-insurances are sort of around there so that they're equal or adequate. And then look at the adequacy also in terms of maximums and things like that, so that people, again, aren't making choices to not take things because they're out of pocket too much.
Got it. And Lana, could you speak a little bit to what strategies employers can implement?
So we tackled a diabetes awareness campaign last year, and it was, I have to say, probably one of the most successful campaigns we've ever run at work in our wellness strategy. And my my team was quite nervous when we started because they were like, we've never done this before. How are we going to, do this? And I just kept saying, like, it's a multi-prong approach. It's awareness, it's education, it's providing supports, it's just creating an environment so that employees not only look at and lean on their benefit plan, but look at their own lifestyle and look at, what are the things that they could do in that preventative space. So if you're asking, just sort of like for a couple of snippets of things that we did with our campaign, we started with awareness and we wanted to engage our employees. And at the end of the day, we just really our North Star is providing wellness campaigns so that employees feel that there's a perception of support with their organization, regardless of what the wellness campaign is. But what is the support mechanism for wellness? So we started with delivering apples on everyone's desk with an invitation to come to our health fair. Then people came to the health fair. There were lots of brochures and information about diabetes awareness. Then we oriented them to the Sun Life Diabetes Care Program and talked about, here is a very specific program that, if it is working for you or your dependents, you have one-on-one coaching, and this goes above and beyond what is typically available in our very stretched healthcare system right now. So it was everything from challenges that we had with employees, participating in like puzzles about diabetes awareness. We were providing healthy bars, fruit, and then really circling back to the health and safety piece, wanting to identify how certain jobs are more at risk for diabetes. So sedentary jobs, shift workers. And so it was a very fulsome kind of, we tackled it from every different angle. And I really think we moved the needle on employees recognizing there were a bunch of people that signed up for the Sun Life Diabetes Care Program. And, it was probably our most successful campaign. Every element of it was fairly simple, but in combination with all how we tackled it from this multifaceted approach, it really did stick.
That's incredible. It goes to show something that you might think is more simple works as well. Alexis, have you seen successful workplace programs that have reduced diabetes-related risks and costs? I know it's a big ask.
No, it's actually a great bridge because Lana mentioned our diabetes care program, and I think it's a really lovely example of something that we recently brought to market, and we are seeing really great outcomes so far. So the program is very customizable, but really begins with a consultation with a licensed pharmacist with Lumino Health Pharmacy that has training in diabetes specifically, and they're able to provide guidance on a range of topics, whether it's lifestyle modifications or medication management, and really help that individual better understand their condition. For those that are interested, they're able to participate in a more fulsome program, a 12-week intensive program that's focused on lifestyle support that combines individual coaching with some group education. And we're seeing really, really impressive results so far. So of participants of the 12-week program, about 95% of those participants have stabilized their A1C levels within a healthy range. And about 40% have achieved A1C levels where they can reconsider the kinds of medication that they're on or reduce the level of medication they're on if that's appropriate for them. Those kinds of results are excellent. And the more that we're able to make people aware that the program exists, encourage them to have that first conversation, I think the more successful we can be in helping them better manage their disease.
And Kim, have you seen successful workplace programs as well that have led to sort of a reduction in risk and costs?
Similar to sort of the approach that Lana's organization has taken, sort of, starting from an awareness standpoint, bridging education to home as opposed to, leaving it in the workplace and things, making sure that there are supports for, I mentioned family members earlier. I would mention that again here to ensure that, family members are getting adequate supports as well, where they are caregiving or where they are supporting, an employee that has been recently diagnosed. Or is working to manage or better stabilize their condition. I would say too, as Alexis mentioned, sort of a one-to-one coaching or health coaching, cognitive behavioral therapy to help people sort of make lifestyle changes or that sort of thing are all super helpful and do lead to better outcomes.
Perfect. Yeah, it's really great to hear that because I'm sure employers are sometimes confused about what they can do that would make meaningful difference. So, I wanted to turn a little bit to sensing-based glucose monitoring technology. How can sensing-based glucose monitoring systems such as Freestyle Libre empower employees or plan members to manage their diabetes more effectively? Alexis, maybe we'll start with you.
Yeah, I think it builds on this idea that when patients have the support and the information that they need, they're then better able to manage their own health. And a sensing-based glucose monitoring system can really provide additional information for an individual to better take control of their daily choices. And so when you have access to real-time continuous glucose readings, that you're better able to track your levels and then make more informed decisions about your diet or about your exercise. And that then results in better health outcomes down the road. I think some individuals are even choosing to share their daily glucose readings with their healthcare practitioners, and that allows a more informed conversation between patient and physician. And really, some just find access to the data helpful in managing their stress and anxiety day to day. So the tool can be a really valuable addition to the toolkit of information that an individual needs to help better manage their health.
Got it. Lana, I wanted to ask you, what can employers do to provide the right access to the right employees, plan members at the right time as it relates to sort of resources, tools, programs, and benefits coverage?
Yeah, so I really do think that these mini health fairs or your communication strategy really helps hotwire this information if it's in an integrated platform that you are not just randomly throwing out pieces of information, but helping it stick for employees. I know Kim had suggested, talking about like dependence also with the plans and I as she was talking about that, I think it was very interesting for me when we had our health fair, our diabetes health fair. We had employees come and diabetes wasn't impacting them personally, but it was impacting them. And Alexis talked about stress because I remember this one fellow coming and he was saying that he and his wife were having fertility issues and she had diabetes. And so we sort of shuttled that family over to the Sun Life Diabetes Care Program and said, hey, why don't you try this? Another example would be an employee that came that said, I was recently diagnosed with diabetes and my doctor just gave me a prescription. And I said, what can I do? Could I turn this around? And the doctor's like, nope, too late. And so we were able to say, you know what? It may not be too late. Like go into this diabetes care program and see what can happen. And like Alexis talked about, this 12-week, tailored deep dive program that is very personalized to optimize your medication and offset with lifestyle changes, diet changes, those types of things. It is I really do believe like it was a game changer for us to be able to not only create awareness, but to add those supports on top of the awareness, because the anxiety that people have, and this was a new learning for me. I did not realize how diabetes is or anxiety is a favorite travel companion when it comes to diabetes. And I think you really have to be mindful of managing both of those things in tandem.
I was just going to say, I would build on what Lana was saying by just saying too that take a look at what your benefits plan covers. Ensure that it is up to date, that it has, as technology has evolved and improved for people living with diabetes, make sure that your plan covers that sort of thing and wraps around community supports as well, but doesn't exclude coverage in your plan at the expense of you don't want people waiting for coverage and things like that in communities. So you want to provide supports early. Again, just also looking at where these things live in your plan. So ensuring that, for example, where you are living in a province with pharmacare, for example, that sensors and that sort of stuff, where possible, can accumulate toward your pharmacare deductible and sort of insulate the plan a little bit. Make sure that, again, take a look at your co-insurance levels and maximums and things like that. Sometimes plans have an annual maximum for testing, like monitoring devices and testing supports that have not kept up with inflation. So making sure that those things, again, are adequate for our current environment is important. Those sorts of things are very helpful. Again, like removing obstacles so that people can get the care that they need.
Yeah. Are you able to speak to at all how sensing-based glucose monitoring systems are able to help plan members manage their diabetes more effectively?
Sure. Well, as Alexis mentioned earlier, I mean, it just provides sort of real-time feedback, biofeedback, basically, so that people can sort of understand how their behaviors impact their blood glucose so that they can make different decisions to stabilize things throughout the day, or at least not experience the same peaks and valleys that maybe they have in the past that, are dangerous for someone living with diabetes in the long term. I think too, as people rethink their career progression or their career runways, we're having people maybe defer retirement and stay in the workplace longer. So we've got older people who are, coming with more chronic disease. Diabetes is certainly one that we see, coming alongside of that. So, I mean, there's the prevalence is there as well as people are looking at that. So ensuring that, again, your plan provides the support so that people can manage their disease and their health, and basically not stay well and at work, not have to make a disability claim as much as possible.
Got it. You've touched on this a little bit, so I'm going to ask Alexis, how can employers create a supportive environment for employees managing chronic conditions such as diabetes?
Yeah, I mean, I won't repeat what Kim's mentioned already about
Mhm.
ensuring you have
Yeah.
a strong benefits plan. I think that's sort of step number one, but there's a lot more that an employer can do to support individuals with chronic diseases at large and specifically diabetes. And let's just think through the stages. So first of all, there's a role employers can play around early identification and prevention in the first place. How do they make people aware that they may have a disease? Do they encourage testing? Do they actually provide opportunities for individuals to be tested? Are they promoting healthy lifestyles at work and so on and so forth? Second, then, for individuals who already have diabetes, what kind of support is in place to help those individuals be healthy while they're at work and also help them manage their disease? And so our diabetes care program is one example, but there are other ways that you can support individuals so that they feel like they have the resources that they need to better take control of their health and manage their disease to avoid further progression. And it can be a variety of things. Do individuals have the support that they need around medication management, for example? Do they know to go to a pharmacist to support that? Do they have the support they need around making lifestyle changes, which can be very difficult to make? And as Kim's mentioned, really sometimes is about making changes across the entire family. So there's a range of approaches that employers can take to support chronic disease management, to support early identification, and then, of course, ensuring that there are no barriers to care when those individuals need to access those kinds of supports.
Perfect. Now, uh, something that comes up in an organization's mind, the cost of it all. How can employers balance supporting employees with chronic diseases while managing organizational costs? Lana, we'll start with you.
That's the challenge, right? It is the challenge. And I think, in the last couple years, I think we've matured in our wellness strategy. So very similar to most organizations that have a wellness strategy, there's pillars of wellness. You have mental wellness or social wellness and work wellness and physical wellness, financial wellness. And I think, in the past, it used to be looked at very much like you would just attack each pillar on its own. But we've matured in our thinking about that model, knowing that, what we talked about before, like physical health impacts financial health, impacts mental health. So a more broad approach, but also with a longer term horizon. And I think that is a challenge to appeal to your senior leadership, asking for funding for certain types of wellness initiatives and programs where you don't see an immediate turnaround, but you're talking about long-term health objectives. So having data and, really good indicators about being able to avoid short-term disability claims, being able to even assume a couple of percentage points in productivity gains does make it easier for senior leadership to agree to and adopt these preventative type wellness initiatives that sometimes are costly, but you have to just keep reinforcing the value of prevention and reinforcing, like, this is a slow, like, I keep telling my senior leadership team, like, we're not making instant pudding here. Like, this is a long process to achieve wellness, and getting them to that mindset is the key to be able to get corporate support for these types of initiatives.
Just build on something Lana said very quickly around using your data to help guide your strategy. And I think that's something that increasingly employers are doing, where when you really understand your population of employees, what their health needs are, that can also be a really valuable tool in building a case for where to make further investment. And I think sometimes employers are surprised by the prevalence of chronic disease, of diabetes, of pre-diabetic populations. And so just understanding what the population looks like can sometimes be a really valuable tool in making a case for further investment in prevention or disease management support.
Sometimes it can be helpful to project the cost of doing nothing, where you're basically showing if we do not invest in prevention and do not invest in some of the tools and supports that can help people living with chronic disease do well and manage their disease effectively, what's the cost curve going to look like? What is the inflationary reality projected to be? So that can also be an important tool that that HR and finance can take a look at to sort of justify, I'm going to say, a budgetary investment.
Great, thank you. Did anyone want to add any final thoughts and any overarching message you'd like to leave with?
Maybe I'll just say for Sun Life, working with our clients to support them and their desire to better support employees around chronic disease management and around diabetes is really important to us. And so we're very excited to continue to invest in chronic disease management support, make people aware of our diabetes care program. Those activities are very important to us as an organization because we think they're good for employees and for employers. And whenever we can support both, I think that's really the goal that we all have.
And if I can jump on what Alexis just said, if she's saying that it's really great to be able to offer this type of care and support for the companies that Sun Life serves, I can say it is a new landscape for employers and for people that are in my position managing benefit plans, where we need to lean on our vendors. We need to partner with our vendors to deliver the best products and services for our employees. And it would be it is an accelerator to the relationship, the health, the integration of our benefit plan and the way that employees are able to be productive at work. So I am also delighted to have the opportunity to be able to partner beyond a very transactional type of contract, because there's some flexibility, there's some ability to work with us. It trickles into our communications campaigns. And I think I mentioned at the very beginning, but I'm super passionate about this, that it really is, it moves our engagement needle overall. So of course we want to tackle diabetes. Of course we want to tackle some chronic illnesses. But we also, at the same time, are moving the needle on employee engagement and sending the message that we are a good employer, because look at all the great things that we're doing that are not available just in the community, or that other employers don't have the capacity or the scope or the resources to be able to wrap around employees in the way that we have with some of these types of wellness initiatives. So I think I'm glad that there's excitement about being able to offer these supports, but because we are like hungry for this type of a partnership.
Perfect. Kim, did you want to add anything at all?
As a consultant or as a representative of the consulting community, it's great to be able to work with both vendor partners and organizations that are value-based, where at the center of their values is caring for people, because everybody wins in the end. Like, we're productive at work, we're productive at home, we're contributing to our communities. We are, I'm going to say, better parents and partners and all those sorts of things because we feel well. So it's great to be able to sort of be one of the legs of the three-legged stool here, to sort of help organizations align with both their business goals, but also the goals they have for the health of their employees.
As we've seen today, managing diabetes in the workplace requires more than individual efforts. From improved access to monitoring tools to better education around prevention, the strategies discussed today point to a much more proactive approach. Thank you so much to our panelists for sharing their insights and to our viewers for taking part in this very important conversation.